Hello and welcome to Basic Spanish for OT, PT, and SLP. My name is Juanita and I will be your host. I am an occupational therapy assistant as well as the author of this book, Basic Spanish for OT, PT, and SLP clinicians in the acute hospital setting. This book, as well as the ebook, can be purchased on Amazon.com. I will leave a link below for you to obtain a copy. Today's video, I am actually taking a step away from the book, and we are going to talk about 15, approximately, I think it is 15 phrases that are showing courtesy or showing politeness when you're working with someone. We know, or if you don't know, I'm going to tell you, we know that we are experts in our field. We work on the muscles and the joints, the ligaments, the bones. That's what we do. But politeness, kindness will take you places that your expertise can never take you. If we want to engage our patient, if we want to improve their participation in the therapeutic process, whether it's English or Spanish, kindness goes a long way. So I want to encourage you to learn these phrases. Hopefully you know them in English, but hopefully you can learn them now in Spanish. So with that being said, vamos a empezar. The first phrase we're going to look at is I'm sorry. So that is to say, lo siento, lo siento, lo siento. The next one, I'm going to give you 3 different phrases to say, and they all mean excuse me. So let's give you an example. If I was walking down the hall and I needed to pass by someone and I didn't want to bump them, I just kind of wanted to pass by, I could say, con permiso, con permiso, con permiso. That's to say, excuse me. Let's give a different situation. Let's say that you are getting ready to talk to a patient and you wanted their attention because they were distracted doing something else. So you can say disculpe, disculpe, disculpe. And that's the same thing if you need, that same thing as excuse me, if you need to get their attention. Okay? And then let's say you're talking and you cough a little. You can say perdón, perdón, perdón. So all 3 of those are excuse me, but generally the situations are a little bit different. But if you learn any one of them, it would be understood that you're trying to say excuse me. Let's say the next one I have down here is it's nice to meet you. So you want to say to someone, you're introduced to them and you want to say, it's nice to meet you. Mucho gusto, mucho gusto, mucho gusto. These next 2 are very important, very, very important. It's the one that we teach the littlest of our humans when they're very young. So please, por favor, por favor, por favor. And thank you. Gracias, gracias, gracias. Let's say you worked with a patient and you plan to see them tomorrow. You can say, hasta mañana, hasta mañana, hasta mañana. So in English, we have a tendency to say to somebody if they sneeze, we say God bless you. So God bless you in Spanish is Dios te bendiga. Dios te bendiga. Dios te bendiga. But it's generally not said if you are saying that for someone who sneezed. You can just say salud, salud, salud. That means health. So that's different than Dios te bendiga, which means God bless you. So God, may God bless you. That is something different. Let's say your patient has reached a milestone. You know, therapy is all about meeting goals, setting goals and meeting goals, setting goals and meeting goals, and they've reached it. And you want to say, congratulations, felicidades, felicidades, felicidades. Another thing sometimes we say to patients is, don't worry, don't worry. No se preocupe. No se preocupe. No se preocupe. A patient you're working with and they're doing a great job. They've done something. Maybe they were afraid and you were able to get them over that hump and they were able to do it. And you want to tell them that was great. And you can say, qué bueno. Qué bueno. Qué bueno. And that means that's great. The next one, you can say to someone, very good. Muy bien. Muy bien. Muy bien. The next one is if you want to welcome someone. And now I have to go back to something I did in the other videos. Remember, there are two forms. You want to either use the masculine or the feminine. So, bienvenido, if you are looking for the masculine term, bienvenido. Or I should say, you're welcome if you're looking for the masculine term, bienvenido. But if you're looking for the feminine term, bienvenida. So, bienvenido or bienvenida. And if you want a combination, then you would say bienvenidos. Bienvenidos. That means you're talking in more than one person. And the last one, if you want to say you're welcome, sometimes the last things that are said before we walk out of our patient's presence is they say thank you. And then you want to say to them, you're welcome. You can say de nada. De nada. De nada. So I'm at the 7-minute mark. I think I'm going to try to sneak this in there. So I'm going to say a word and you try to figure out what I said. The first one, lo siento. The next one, de nada. The next one, con permiso. The next one, bienvenido. Mucho gusto. Muy bien. Por favor. Qué bueno. Gracias. No se preocupe. Hasta mañana. Felicidades. Disculpe. Salud. Perdón. So I see that I'm at the 9-minute mark, and I told you that I want to keep these videos less than 10 minutes so you have an opportunity to listen, learn, and repeat. Gracias por venir. I will see you in the next video. Adios.